Hi, I'm Nurse Liz. I'm going to be taking care of you today, okay? I understand that you came in because you're not feeling great. I'm really sorry about that. And we'll get it fixed as soon as we can, okay? So, I'm going to get to my assessment in just a few moments, but since this is your first time visiting our clinic, I'm just going to need to get some information from you, okay? Great. Yeah, so this is just to register you to get on our patient portal. So anytime you come back in, we can easily pull up your information, and also to get an idea of your health and what your issues might be today, okay? So we can get you out of here feeling much better, okay? So can you confirm your first name, your last name, and your date of birth? Great. What is your age? Last known height and weight. It doesn't have to be perfect, just a ballpark estimate is good enough. Okay. What is your best contact number? So this can be either your mobile phone number, house phone number, or an email address if you prefer. Okay, your mobile phone. And what is that number? Perfect. Who is your insurance provider? Okay, and is that through private insurance or does your place of work cover that? Okay. What is your pharmacy? Yeah, so it can be the closest one to you, or if there's a specific one that your insurance needs to go to, that one. It's just wherever, in case you need medication today, we can send that prescription over. Okay, and what location is that one? You said 720 Farm Hill, okay. Are you currently taking any medications? So that could be anything you're under for today. These are today's specific questions now. So if you're taking any ibuprofen, anything like that. Okay, so just ibuprofen. And when was the last time you took that? Okay, about 3 hours. When was your last physical? Are you up to date on all of your vaccinations? Is there any previous medical history I should be made aware of? So do you have asthma, do you have heart issues, high cholesterol, anything like that? No? Okay. Do you have any allergies to any foods or medicines? And what happens when you take medicine? Okay. And what brought you into here today? Why aren't you? How do you feel? Okay. So we're just going to go ahead and get your vital signs before I get started. Clip here. Yeah, so that's just going to go ahead and measure your pulse, O2 saturation and temperature, okay? And while I get that, I'm going to check your blood pressure. So I have a blood pressure cuff here. So just stick your arm out for me and relax as I pump it up, okay? Okay. So your blood pressure is 130/90. Okay, I'll take that clip from you. Okay. So you have a low grade fever of 38.5 Celsius or 101 Fahrenheit, and your blood pressure is elevated to 130/90. Your oxygen saturation is at 98, which is fine, but your pulse is elevated. For what we would expect if you're not taking any medications. So all of those together means you usually have some sort of infection, but I feel like you knew that coming in, that's why I came to visit us. Now I'm just going to assess and see if it's a bacterial or a viral infection, because that does make a really big difference to us. If it's viral, all we can recommend usually are fluids and rest. Sometimes there's a specific antiviral, but not as often. But if it's bacterial, we're going to give you the correct antibiotic to treat that, okay? Okay, so I just want to go ahead and listen to your lungs. So you just remain the same. I'm just going to go ahead and listen to you in the front and back. So I'm going to start by just asking you to breathe normally. Okay, in and out. Okay, deep breath in. Good, deep breath out. Alright, listen to you from the back. So take a deep breath in. Good, again. Good, again. Good, again. Okay. And you said that your breathing feels normal when you do that, right? Not too laboured. Alright, and I'm going to go ahead and listen to you, and I want you to take a deep breath in each time, okay? Ready? So, deep breath in. Good, and again. And again. And again. Okay. And listen to that. Same thing. Deep breath in. And again. And again. Good. And again. Lovely. And how does your breathing feel when you take your deep breath in versus a normal breath? Okay. I can definitely hear that your breathing is laboured, and it sounds like there's something in there. There's a bit of a rattling noise, especially when you take that deep breath in. So we'll have to closer look at that and combine it with everything. Okay, so I'm just going to go take a look at your ears, nose and throat. Okay, so I'll start with those ears. Just open up on the side here. And how do they feel? Do they feel tender to the touch or anything? Okay. Yeah, they do seem a little red on the inside. I'm going to ask you to stick your tongue out and say ah. Okay. And just touch it back a little bit and take a peek up your nose. I know. Unconventional, but so how do they all feel? Okay, yeah, I can definitely see your sore throat, your glands definitely feel a bit swollen. I actually just want to go ahead and feel those if that's okay. So I'm just going to go ahead and touch around your lymph nodes. Okay, I'm going to go ahead and touch your sinuses at the top as well. Yeah, okay. How does it feel if I touch here? That's tender, and here is tender as well. And if I touch the side of your glands, same thing? Okay, great. Okay, so based on my information there, definitely seems like you have a pretty severe lung infection. I'm going to go ahead and guess pneumonia. Yeah, so pneumonia is pretty common. You can either have a viral cause or a bacterial cause. So nothing to worry about. You could pick it up from anywhere. But do you know if you've been in contact with anybody who has had pneumonia in the past 6 weeks? Okay, that's no worries. We're just trying to see, we ask those questions to see if there's a community outbreak or something like that, but that's no worries. Okay. So before I can prescribe any treatments, we're going to have to do a rapid strep test to determine if it's caused by, a group A strep. Like Streptococcus pneumoniae is the common one, but there's a few other ones in that group. And if that comes back negative, we're going to test you for one other rapid test, the Mycobacterium pneumoniae, which is also very common. We need a sputum sample. It's still pretty fast. And if those both come back negative, we're going to go ahead and treat it like it is a virus. And if you don't improve over about 5 days, then we'll come back in and we'll do a more comprehensive blood test to see what it is. Yeah. So we don't want to overprescribe antibiotics, even though people who have viral infections sometimes ask for them. It's leading to a bigger problem of antibiotic resistance, and if you have a virus, they won't do anything. So we'd rather underprescribe versus overprescribe, okay? So for the rapid strep test, I do need a swab. It's not comfortable, but I'm going to ask you to stick your tongue out. Yeah, just go back there and put in the solution. Okay, so ready? Okay, yeah, it's all done. So I'm going to let that wait there. That's going to take about 10 minutes. Just hang tight. I do need to go check on another patient, and I'll be back with you in just a few moments, okay? Okay. Hey, thanks for hanging tight for me. Let's go ahead and take a look at that test. Okay, so that did come back positive because of the colour change, which means I'm going to go ahead and prescribe you some antibiotics. Now, because you said you were allergic to penicillin, I'm going to recommend and prescribe for you the ceftriaxone. So it's a different class, you shouldn't have any reaction to that. And you're going to take that twice a day with a meal, okay, for 10 days. Even if you do feel better, don't stop taking it before the 10 days is up. If after 10 days you still don't feel good, I recommend either coming back to us, or if you notice, at about day 7 you're still not feeling great, make an appointment with your normal GP, okay. Of course you can come and see us at any time if you need to, but that should hopefully have you feeling a lot better within 24 hours. Not perfect, but should definitely help relieve some of that congestion, make it easier for you to breathe, okay? I'll go ahead and send that prescription over to the pharmacy. I do recommend taking a few days off from work or school, just because pneumonia can be very taxing. So if you need a letter of absence for school or for work, you can stop by the nurse's station on your way out, and they'll have something for you, okay? Fantastic. I hope you're feeling better soon. Alright, take a few minutes to gather yourself, and hopefully I don't see you anytime soon.